There is a small gland, roughly the size of a walnut, sitting quietly beneath the bladder in every man's body. Most men never think about it until something goes wrong. And by the time many men finally do think about it, the warning signs have often been present for months, sometimes years, dismissed as nothing more than an inconvenience of getting older. An extra trip to the bathroom at night, a stream that isn't quite what it used to be, a sense of urgency that seems to come out of nowhere. Individually, each of these feels minor, easy to explain away, easy to ignore. And that is exactly what makes prostate changes so easy to miss until they've had time to develop into something far more serious. This video is going to walk through the early signals. The prostate sends out the ones most men brush off, the ones many doctors don't always ask about directly, and the ones that, when caught early, make an enormous difference in how manageable any underlying issue turns out to be. By the end, the full picture will be clear. Which signs are genuinely worth watching? Which ones are usually harmless, and exactly what steps to take if any of them sound familiar. Because here's the part that matters most. The earlier these signals are recognized, the more options a man has, and the simpler those options tend to be. Stay through this, because the fourth sign on this list is the one that catches even health-conscious men off guard. Precisely because it doesn't seem related to the prostate at all. Why the prostate sends such quiet signals. The prostate sits in a location that makes its problems easy to misread. It wraps around the urethra, the tube that carries urine out of the body, which means that even small changes in the size or condition of the prostate can affect urinary function long before anything shows up as pain or a clear, unmistakable symptom. This is part of why prostate issues are so often mistaken for ordinary aging. A slightly weaker stream, an extra bathroom trip at night. These changes tend to arrive gradually, over months or years rather than suddenly. And because they arrive slowly, the body adapts. And the man adapts along with it, adjusting his habits without ever stepping back to notice the pattern as a whole. That gradual, easy to normalize nature is precisely why understanding the specific signs, rather than waiting for something to feel dramatically wrong, matters so much. 4 early signs worth paying attention. 1. Changes in nighttime. Urination, waking up once during the night to use the bathroom is common and, on its own, usually not a concern. But a noticeable shift, going from rarely waking up to needing the bathroom 2, 3, or more times a night, is one of the most consistently reported early signs associated with prostate changes. This happens because an enlarged or irritated prostate can press against the bladder or urethra, reducing the bladder's effective capacity and increasing the frequency of the urge to urinate, especially when lying down and when the body isn't distracted by daytime activity. Many men chalk this up to drinking water too late in the evening, and while that can certainly play a role, a persistent pattern that doesn't improve with simple adjustments is worth paying closer attention to. 2. A weaker or interrupted stream. This is one of the signs men are often the most reluctant to mention, even to a doctor, simply because it feels like an oddly personal detail to bring up. But a stream that has become noticeably weaker, slower to start, or that stops and starts during urination is a classic early indicator that something is affecting the flow of urine through the urethra. Because this change tends to happen gradually, many men don't consciously register it until it's pointed out. They've simply adjusted, standing a little closer, taking a little longer, without ever connecting the dots. If this sounds familiar, it's a meaningful enough pattern to mention at a routine checkup, even if nothing else feels wrong. 3. A sense of incomplete emptying finishing urination and still feeling like the bladder hasn't fully emptied is another commonly reported early sign. This sensation occurs when prostate changes interfere with the bladder's ability to fully empty during urination, leaving a small amount of residual urine behind. Beyond simply being uncomfortable, this pattern matters because retained urine can, over time, contribute to a higher risk of urinary tract infections and further bladder strain. It's a sign that's easy to dismiss as unimportant in the moment, but one that tends to reflect a genuine underlying change worth discussing with a healthcare provider. 4. The overlooked sign, unexplained lower back or pelvic discomfort. This is the one that surprises most men because it doesn't obviously connect to urinary function at all. A persistent dull ache in the lower back, pelvis, or area between the legs, one that isn't clearly explained by an injury. Exercise or physical strain can, in some cases, be linked to prostate inflammation or other prostate-related changes. Because this kind of discomfort is easy to attribute to a bad mattress, a long car ride, or simply getting older, it's frequently the last symptom men think to mention when discussing prostate health, if they mention it at all. But when it shows up alongside any of the urinary changes already described, it becomes a pattern worth bringing to a doctor's attention specifically, rather than treating it as an unrelated, separate issue. Why catching these signs early actually matters. None of these 4 signs on their own mean something serious is happening. Many prostate changes are common, manageable, and unrelated to anything dangerous. The prostate naturally tends to enlarge somewhat with age in a large percentage of men, a process that on its own is not inherently harmful. But here is the important distinction. Recognizing these patterns early gives a man far more options than waiting until symptoms become impossible to ignore. Many prostate-related conditions, when identified early, can be managed through simple lifestyle adjustments, monitoring, or straightforward medical treatment. When identified late, the range of available options tends to narrow considerably, and the interventions required tend to become more involved. This is really the entire point of paying attention to early signals in the first place, not to create alarm over every minor bathroom trip, but to notice genuine patterns early enough that a conversation with a doctor happens on a man's own terms, calmly and proactively, rather than being forced by a situation that has already become urgent. 2 common myths that cause men to wait too long. Beyond the signs themselves, there are a couple of widely held beliefs that quietly convince men to delay getting checked, even when they've noticed something worth mentioning. The first is the belief that prostate issues only affect much older men, so anything noticed in the late 40s or 50s can be safely ignored. In reality, prostate changes can begin developing well before symptoms become noticeable, and the earliest, mildest signs often appear years before a man would typically associate them with prostate health at all. Waiting for a symptom severe enough to feel unmistakably prostate-related often means waiting far longer than necessary. The second myth is the assumption that any prostate-related conversation automatically leads toward an uncomfortable, invasive procedure, which leads some men to avoid mentioning symptoms altogether. In practice, most initial evaluations start with a conversation and, if needed, a simple blood test. A far less involved process than many men expect, and one that provides valuable information regardless of what it ultimately shows. Both of these beliefs share the same effect. They turn a simple, low-stakes conversation with a doctor into something men quietly postpone, sometimes for years, based on assumptions that don't hold up once examined closely. What to actually do? If these signs sound familiar, the most important step is simple, and often the one men delay the longest. Mention it to a doctor, not because every symptom indicates a serious problem, but because a proper evaluation, which may include a simple conversation about symptoms, a physical exam, and sometimes a blood test, is the only reliable way to understand what's actually happening and rule out anything that needs closer attention. Beyond that conversation, general prostate and urinary health tends to benefit from a handful of well-supported habits: staying adequately hydrated throughout the day rather than concentrating fluid intake in the evening, maintaining regular physical activity, moderating caffeine and alcohol intake, both of which can irritate the bladder, and maintaining a healthy body weight. Since excess weight is associated with a higher likelihood of urinary symptoms, none of these changes are dramatic, and none of them require waiting for a diagnosis to begin. They are simply supportive habits that make sense for most men in this age range, regardless of whether any of the 4 signs discussed today currently apply. This video is intended for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Prostate symptoms can have a wide range of causes, some entirely benign and some requiring medical attention, and only a qualified healthcare provider can properly evaluate individual symptoms. Any man experiencing persistent changes in urination, pelvic discomfort, or other concerning symptoms should schedule an evaluation with a doctor rather than relying on self-diagnosis. The prostate rarely announces problems loudly. It tends to whisper through small, easy-to-dismiss changes that accumulate quietly over time. Learning to recognize that whisper, rather than waiting for it to become impossible to ignore, is one of the simplest, most effective things a man can do for his long-term health.